who were, kicked out of their homes for being gay, for being trans, and were living on the street, they found housing for them. And that was their mission, was to make sure that these kids and young people had the opportunity that they didn't have. But because there was no funding for them, they prostituted themselves in order to serve the community that they felt was important to uplift. They marched for us. They, were involved in creating, or at least trying to draft legislation to change the world for people of the queer community, right? Gay, lesbian, transgendered, bisexual, all of us within the blanket. But then they were pushed into the margins because they weren't the ideal image of who was expected to be leaders in such a movement. This is Jane Addams. Jane Addams, we're rolling back to the old school. She was one of the first American female recipients of the Nobel Peace Prize. She won that in 1931. She was the founder of Hull House, which was America's first settlement house. So basically, Hull House would offer what we consider to be social services. She housed people, she gave them job training, she had daycare centers. There was all kinds of educational things that she put into place, taught people English because she was in the South Side of Chicago, which was a predominantly Black and immigrant neighborhood. She was actually one of the founding members of the NAACP. What many people don't know is the NAACP was actually an organization that was created by Black and white people in the effort to advance the position of, individuals who had been freed from slavery only 20 years before. She was also a major advocate against the war, in this case, World War I. And so for all of her efforts, she won the Nobel Peace Prize, and then shortly thereafter was seen as the most dangerous woman in America because she was opposing a war while Americans were at war. And the last example is Dolores Huerta, who is alive and well right now. She is, I think, 90 years old at this stage, but she was one of the co-founders of the United Farm Workers Association. So over here is a picture of her and Cesar Chavez. And she was, and still is, very much an advocate for the formation of unions, of people gathering together and using their political voice in order to affect social change and achieve equality and fairness within our economy. So I'm showing you all of these because I want you to understand, number one, what it is that I do, why I do it, the research that goes into it, but also the fact that, by seeing these visuals, you get a sense of who these people were in a way that just hearing the story doesn't quite do it, right? And so that's something that I want us to be able to explore today, this idea of art and activism. So you are all here in this meeting because you are activists in your own right. Everybody thinks of activism as those people who, get their signs out and go marching in the streets and protesting and, brave the weather and the police and the, tear gas and all that other stuff. But there's so many facets to activism, so many different ways in which we can get together and use our voices to make change. And so, the examples that I showed you were not only my form of activism, but there are also examples of different individuals who applied different forms of activism. Jane Addams opened up a place that would provide services that the government wasn't providing at the time. Marsha P. Johnson and Sylvia Rivera, they were those activists on the street, as was Dolores Huerta. But then they too opened up a place that would serve the purposes for the people that they needed to serve. Shirley Chisholm, she took her activism in the more mainstream route. She said, I notice that the system is messed up, so I will enter the system so that I can change the system. So this is absolutely essential to realize that there's so many different ways of going about the same thing, and all of these different ways are absolutely essential And so I see them as part of the tapestry of what activism is. So in this workshop, we are going to, for those of you who are capable, I understand there is someone who is visually impaired and therefore will not have seen this, will use art in our own way and figure out how we can have our own voice within this activist space. And so we're talking about this idea of health advocacy, right? Healthcare, which is definitely a place that is in dire need of activism at this day, in this day and age, because of decisions that have been made for many of us long before we were actually born. And so I noticed that my face is being pinned. Oh, okay, no, they're both pinned. So I'm going to switch to the paper right here. It's in front of me. So we're going to do a process which is called thumbnailing. And so what thumbnailing is that you are creating just like a shorthand of an idea. We're getting ideas out of our heads. So similar to taking notes with, by writing words on the paper, we're going to take notes in a way by drawing pictures on the page. So in this part, I would love to get a little audience participation. We'll start with words, but then we're going to roll into picture. So if everybody is down for that, or whoever is down for that, I would appreciate your participation here. I'm going to bring up my chat window so that if anyone has any questions that they wish to ask and they are a bit shy about having their voice heard, then you can go ahead and put it in the chat. But if you can speak aloud, I would really appreciate that. So let's talk about healthcare and healthcare advocacy. What are the things that are important to us? And whatever comes to mind, just go ahead and either shout it out or, as I said, put it in the chat if you're uncomfortable. Affordability. Okay, that's a good start.
Equity.
Equity. Culturally appropriate. That's a great one. Racial justice.
Universal.
Universal. What else we have?
High quality.
Ooh, high quality, essential. What else? I'm sure there's more. I'm sure there's stuff I haven't thought of.
Patient-centered.
Oh my goodness, yes. Patient-centered.
Transparent.
Mm-hmm. Accessible is in the list.
It's a right.
It's a right, yes.
Mind and body.
Mind and body, so holistic in a way, right?
Mm-hmm.
I'll write both.
Dignity.
Dignity is essential, yes.
Respect.
Respect. Mm-hmm. All right, let's get a couple more. Do we have a couple more?
Inclusive to people with disabilities.
Mm-hmm. And one more?
Navigable.
Oh my God, yes. All right, brilliant. So yeah, I mean, so we have these words, right? So I've written them out. Affordability, equity, culturally appropriate, racial justice, universal, high quality, patient-centered, transparent, accessible. It is a right. mind and body or holistic, dignity, respect, inclusive of folks with disabilities, and navigable. So all of these things are essential. And I would imagine that in coming up with these words, each one of you has a story that is associated with this situation, right? Of whatever word that you put out. And so it is the stories really that are the most important part of sharing, or I should say, they're the most important part of activism, because you can say, we need to do this because it's the right thing to do. And that's going to hit a certain way. Some people, their value system is such that they'll be like, you're right, this is the right thing to do, let's change. But for many, their value systems are such that they need more information, they need more proof. And so when you start telling your stories, that's that proof. That's that thing that taps into the emotions, that hits that right brain. And the right brain is like a direct connection to the body, right? You feel right brain things, whereas you think about left brain things. So when you say, we need to do this because it's the right thing to do, that's a very left brain. You're like, okay, logically, yes, I can take that on. But when you tap into somebody's emotional center and you get their body involved, then it's really hard for the mind to not follow. So let's tell a story. I'm going to tell you one of my stories real quick, and then we can experiment with putting this into pictures. And then if you guys want to, feel comfortable enough, I'll say that, to tell an aspect of your story, or, then we can figure out together what that visual will look like. So if you had not noticed, and for those who are not capable of seeing me, I'm a Black woman. I'm an immigrant. I am lesbian. I am a military veteran. So there are a lot of different aspects to me and how I navigate through this world that dictate what kind of outcomes I receive, especially when it comes to healthcare. So I go through the VA Medical Center, and for the most part, I've been with the VA for 15 years now. And most of my doctors, my primary care doctors, have been white men. And an interesting thing that I've noticed is that if I go in with some kind of ailment, they ask all the right questions, but I notice that they don't always put down the right answers. I had a doctor who was asking me about, like I went in because I was having a cough and some breathing issues. And, he asked, yes, I will describe the pictures aloud. So we're not on pictures just yet, Mary. So thank you for bringing that up. But yes, I will describe what I'm drawing when I get to that point. Thank you for the reminder. So I had, he was asking me all these questions, and he was like, do you think you're experiencing anything like postnasal drip? And I was like, you know what, I might be. I feel like this cough happens when I'm congested, and that is a thing. So, he took some notes and then called in somebody else to confer. And then during the course of reading over his notes, he was like, no postnasal drip. I'm like, no, I literally told you that was a thing that was happening for me. And so to know in real time that this person was literally not listening to my needs as I was speaking them, asked me a question and didn't bother to write down the correct answer, that was a problem. And so recently, within the last couple of months, I actually got a doctor. I was told that I had to get a new primary care doctor, as happens with the VA, there's a rotation. And so I was like, do you have any women, and particularly, do you have any women of color who could be my primary care doctor? And this time around, they were actually able to say yes. And so my doctor is currently a South Asian woman. Not only does she ask me every single question under the sun, she remembers the answers. She calls me up, like literally I got a call yesterday about tests that, are either she ordered or other doctors order, because the cool thing about the VA is that everything's interconnected. So if I have to get any kind of testing for anything, my primary care physician sees it. So she calls me up personally to give me the results. And then she remembers things like the fact that I'm not super into meds. And so, you know, whenever she's coming up with a solution, she tries to find a more holistic solution, something that is food-based as opposed to pill-based. The difference is night and day. I feel like I am part of a team now, as opposed to having a person ignore me, which means that I feel like I'm going to ignore them. And then I go off and find some other remedy on the internet for myself and hope for the best, you know? And that's a positive outcome. And that is a new thing for me. And so that is my healthcare story. So let's think about this and how would I show this in imagery, okay? So I'm drawing a picture of just, you know, we're doing stick figures, y'all. We are not going into high art right now. And this is an essential part of thumbnailing that I want all of y'all to understand. This is a visual shorthand, much like writing words on paper is a visual shorthand, okay? It is a way of getting a picture out of our head. So we've got, you know, a picture of a person in a lab coat, right? Yeah, yay for stick figures. And, you know, this person is sitting, I'm drawing them kind of lording over me in a way, right? I've drawn them really big and myself really small, because that's kind of what it feels like when you go into an office where they're not paying attention to you, where you're not feeling like you are being heard or like your needs are being met. And so you don't feel like you're part of the team. You feel like you're separated from it, right? And so even in the course of having a phone call, so I'm drawing a picture of old-timey phone. We're not doing cell phones here. This, I want you to feel like this. It's got the cord and everything. I had a phone call with an advocate, with a nurse who was telling me that I could have a new primary care physician. And so I asked, right, question mark, if I can have a woman. So let's draw the Venus symbol, right? So a circle with a cross underneath, that is the symbol of femininity, right? So I asked if I can have a female doctor, and I'm drawing with a pencil. I don't know how to put POC, so I'll just have to write the words POC, you know. And, you know, that was my way of advocating for myself. Okay. And then I got a POC. So then let's do a check mark, right? With a woman symbol and POC. That was the positive outcome that I received. And then I got to have a doctor. So we're going to draw a person with a lab coat, but this time we're on the same level. We're facing one another eye to eye. We're working as a team, right? We can put a little equal symbol next to it, right? Because that's the experience that I've had of, you know, that feeling of equality. Now, I am a more or less a realistic artist. You know, I tell stories by looking at people's actual faces, and I think about figurative. But let's think in a more abstract sense, right? Because I would imagine that, you know, each of you has different artistic sensibilities. How did this make me feel, right? This feeling small. So I'm all the way to the left again, where I'm looking at the situation where we have this doctor who is not listening to me, as much as I advocate for myself, is not taking in my words, right? And so I'm just going to throw some scribbles under here. I feel like scribbles, that is like a great way of showing that uncomfortability, right? It's disorganized markings. There's something about it that feels very visceral. And so that shows my emotional sense behind it. In asking the question in this phone call about having, you know, a woman of color, and knowing that in the past, when I've asked this question, the answer has been no. And I've received, you know, I had a primary care doctor who like literally barely looked at me during our appointment, you know, touched me enough to check my pulse, and that was kind of it. And the nurse practitioner had done that before. Mostly, you know, looked at his notes that he was taking while asking questions out the corner of his eye. Like, that doesn't feel like care to me. So there was trepidation. I was nervous about asking that question. And so let's do some wavy lines, you know, because waves don't feel necessarily comfortable, right? And let's do some of them that are a little askew, to kind of show that there was a discomfort in even approaching this question, but I knew I had to do it, right? And then that feeling that I had when I actually got the doctor who is helping me, is acting as a team, as a teammate, as an advocate, who is ordering tests to make sure that things that every third doctor catches, you know, are not still an issue for me, or I should say, are still not an issue for me. I'm very fortunate to be quite healthy, and so I know that, you know, the experiences I have, they're like mini traumas. But I would imagine that some of you in this space have had significantly more traumatic experiences, which would give you, you know, much different markings, right, when you are kind of talking about your feelings of it. So what's a good feeling of elation? You know, let's do like some jagged lines, you know, kind of celebrating, like, yes, this was awesome. This is the thing that we're looking for, right? And I put that around the experience, because like being inside that experience is that level of exciting to me. So that's me and my story. At least one aspect, right, of my story with the healthcare system. Is there anybody here who would feel comfortable about sharing and would, you know, want to help figure out how they would portray their story and their feelings around their story in picture form? And if
So
not, sorry, go ahead. Yes, Adam.
I was just going to say, folks, feel free to unmute yourselves, because that's probably easier than dropping it in the chat.
This is Mary. Really quick question for those of us who are unable to do picture but would like to share. Would you allow emojis, or would you like us to share? What is the best way to go about this?
You know, that is a great question. And I, you know, I'll be honest, I found out that you would be participating shortly before this began. So,
oh, no worries.
what, I guess, like, what is your artistic, how do you take an art? I would imagine sound, music are on the list of things that you experience.
You know what? Yes, you're absolutely right. It's very, very auditory, and I don't have any kind of like clay or anything to show. Like if I do art, it's very much, it's not drawing, it's more of a tactile thing, or audible. But what I can do, so I don't take up anyone's time, is I can send emoticons in the chat box to show. I don't know if people are sending their photos in or how that works.
Yeah.
Or I can just happily wait.
Absolutely. So basically, like, it's not even, you know, this is not like a class in which I expect to see the results.
Yeah, this is more just for you. I mean,
exactly. Yes, that's it. You know, so I'm giving you tools, different ways of thinking about how to express yourself, that might be different than what we're accustomed to, which is using our words. And so, you know, if for you, something more tactile will describe your experience, and that's something that you can share with others down the line. I just want you to know that that's an option. That's, you know, that's thinking about it. So it's
fantastic.
Yeah, that's really all.
Very helpful.
Okay, cool.
Thank you so much.
You are welcome.
I do have a Zoom friendly story, healthcare story, if that's okay.
Yes.
So I am disabled and I use different mobility aids at different times. And I had a new doctor who had only met me in a wheelchair. And I had the sense that he was not really taking my concerns seriously. And he seemed to be focused very much on the wheelchair. and not really on what I was saying or what I was experiencing. And so his advice was very simplistic. And I'm very educated. I've been in this body a long time. And so it was hard to not feel a little insulted, I'll be honest. He seemed well-meaning, but just wasn't meeting me. And so at the beginning of the pandemic, I had to have a phone consultation with him, which ended up being a video chat. And I decided to turn my camera like this. So I turned it to my bookcases, to my walls and walls of bookcases. And it may have been a little subterfuge on my part, but I just was curious if he would at all meet me differently. And we've now had 3 consultations where I've had my bookcases prominently displayed, and sometimes I turn them to selectively focus on, medical textbooks, and, to show that I'm educated, that I'm not just a patient in a wheelchair who doesn't have a lot of understanding of things. And I found the very first time that we met via Zoom, he ordered tests that I had asked for 6 months. He asked me questions that made me realize he understood the very complex underlying issues that I was dealing with. And it was rather startling to me, the difference in how I was treated. So that's my little Zoom-friendly healthcare story.
That's beautiful. And that, that strikes to the heart of what it is that we're talking about. You actually used a visual aid in order to advocate for yourself to a person who was not taking you seriously. And so showing your education rather than telling your education makes such a big difference, and obviously has yielded more positive results. And as highly unfortunate as it is that you had to use that tactic, you now know that it works, right? And so that's something we can do.
I might carry my books around with me.
I was like, I'll be honest, I am not disabled, and that's not on my list of things to do. I was like, man, that sounds like a burden to me. I would imagine, mobility was your challenge, that would be a whole extra thing.
Right. Right.
Adri, do you want to describe a little bit what you drew as Afton was talking?
Yes, absolutely. So as Afton was talking, I was basically doing a visual shorthand of the words that she was saying. And so, she spoke of how in having this conversation with the doctor, that initial consultation, she was in her wheelchair, and that was the only thing that he was focused on. And so I drew a picture of a wheelchair. Very badly. This is bouncing on 2 wheels. It needs like the little ones. That wasn't, but it's about the idea, right? Not the accuracy. And then to show that the doctor was not listening, was not paying attention, I drew a picture of an ear inside a circle with a cross, that quintessential like Ghostbusters, kind of thing. And then, she said that she's very well educated. She's been in this body for quite some time. So I drew a picture of basically, it's like a scroll. I was going for a diploma. And then I eventually doubled back and threw a stack of books in there to just kind of double down on that education aspect of it. And then she was talking about how, she had to do a consultation via phone, or a phone consultation. So I drew a picture of a phone first. And then she said it was a video conference. So I drew a screen with a person in the center. And then when she said that, she had showed her books, the bookcases in the background, then I drew a picture of some books. And then I threw a question mark in there because now he started asking questions and offering tests. I couldn't think of a good shorthand for tests. So if any one of you has a great shorthand for tests, I would highly appreciate your sharing that with me. But yeah, to show that, now there is an exchange, there's a dialogue. And in a lot of ways, actually, I can come back to this image, right, of the doctor and now Afton being on the same level. So I just drew that, just two figures facing one another and, clearly in equal conversation. So thank you so much for sharing that. And this isn't the only way, like, this is like, so that's the thing about thumbnails, right? I'm getting the idea out. This is not by any stretch a final picture, but it's the kind of symbolism that I would use or that I would seek out in putting together a final picture. And so, maybe, right, so I'm circling the question mark here, like, okay, that has to do with this exchange back and forth of him asking questions and actually following up on requests, but then also ordering tests. Like, okay, well, this is where I would go into Google and be like, okay, medical exam, and then do an image search and just see what pictures come up for medical exam. And so just in case I don't have a clear idea in my mind of what a visual shorthand would be, see if somebody else has come up with something that would make sense, that I can use to visually portray this story. Does anybody else want to share something that they have?
Hi, I think I have one. I have chronic migraines. They're hemiplegic, so they look very much like strokes. But I've had them since I can remember. And anytime I go in, if I need a doctor's note or just need medication, instead of listening to me, telling them, hey, I'm just getting a really bad migraine, can you help? I'm sent to the ER. And it's that, again, pattern of I've lived in my body for 27 years and have gotten migraines since I was 7. But every time I try to seek help for it, I am sent to urgent care, which means just bills and a lot of prodding of my body. And yet again, no one listening to me, because they know better. But their medical education, while I value greatly, does not mean that they know Miriam's body. I am Miriam. So it's like, hello, this is me. Let me give you knowledge about how my body works so you can help me. And so this is just a pattern I've been noticing, as well as with mental health. Since I also have PTSD, it's yet again that pattern of, hey, I don't feel good. I don't want these meds. But it's just been constantly prodding with no one listening until I get really loud. And even then, that's when it's taken as, oh, you have mental health problems, where it's like, no, bro, you're just not listening to me. Yeah.
Yeah. Okay. Thank you so much for sharing that. And it's so frustrating, right? Like, and especially if you are any kind of minority already, to enter this system, which is so incredibly elitist, where they're supposed to be helping you, like they're there to serve you, and yet that is not how you feel when you're entered the situation. So in order to tell this story, right, you have migraines, so I've got a picture of a person, and then there's these kind of like wavy lines coming out of the head, to show that that's pain. You went in to ask for meds, so there's like a pill bottle. I couldn't think of a quick thing for emergency room, so I drew a cross, and then just like some distress lines around it, kind of like the pain lines that are coming out of the head. I feel like the emergency room, I feel like there's something intrinsically stressful about an emergency room, right? And so like, it feels like a place that you should be able to go and get care, but you just get stress and apparently not care, right? Apparently you go in and you have this experience where they're still not listening to you. So you were sent by a person who didn't listen to you to another group of people who didn't listen to you.
To go home with a big medical bill.
To go home, exactly.
Yeah.
Yeah, and so actually, that's a fair point. So let's do the money symbol, because that's an aspect of it as well, right? And like a bunch of them. because that's an expensive prospect. And every single time you were pushed off, so I draw an arrow going in a direction, you're still not listened to. And let's throw some more money after that, right? So every time you're not listened to, that costs you money. But what you would like to have is a back and forth exchange where you have somebody who trusts you. So I've got two arrows going in opposite directions, one on top of the other, to show this idea of exchange. And if you had that, then you would actually be able to get the care that you need, but you don't, right? That's not happening. And so you shout. And so I have, go on
I think
ahead.
a great point you put, right, is they don't trust me with my body.
Yes.
They don't trust me with my body or my symptoms or what I might need.
Absolutely. Yeah, so I mean, I don't have a picture for this. So if any of you has an idea, how would you portray this notion of lack of trust? Like what imagery comes to your head when somebody doesn't trust you or you don't trust them?
Maybe something like hands that are going to shake, but with sort of a barrier between them or something like that.
Okay, that's interesting. So let's do that. So we've got a barrier. We got a hand coming in one way, fingers. And then we've got a hand coming in the other way. Let's throw some fingers there. Right. Mary, I am curious, in a tactile sense, how would you indicate this idea of lack of trust? Like what feeling, what physical feeling would that give you? Or like what auditory feeling would that give you?
Well, I think about tone. That's a huge thing. I don't know if that falls into the artistic category.
Say that again. About what?
Tone of voice.
Yes, absolutely.
And I think about if somebody sounds unsure or if they say, to me, it's, do you really know what you're talking about? And I have definitely been there when it comes to healthcare. So a huge part auditorily would be someone's tone of voice.
Absolutely. I'm drawing that emoji that has like that skeptical face with the hand underneath the chin.
Oh wow, cool.
Yeah, no, that was perfect.
I didn't even know that
got me
existed.
there. Yeah, no, that got me there. I hadn't even thought of it, but that thank you, Mary. You actually added to my visual vocabulary. So
Well,
that was
thank you
awesome.
for asking. Yeah.
You might also be able to illustrate it as sort of musical note dissonance.
Oh yeah. So
I don't know
like
if that feels appropriate, Mary, but I think from a sort of musical sense, I think there are some beautiful forms of dissonance, but there are also very grating forms of dissonance in music that can be quite illustrative.
I'm not familiar with the word dissonance is, if you can explain that briefly, but when you did mention music, you could maybe draw like a minor note. You know how a piano has those 88 keys or however many keys it has, and there's major and there's minor.
Yep.
If you draw like a minor, like I don't know what it would look like exactly.
there's
But
a little
maybe you
B
can,
next to it for minor.
okay. So yeah, you could draw that too.
Yeah. Yeah, basically dissonance is when you hear like sounds that don't feel good in your ear, right? Like it grates, the sound makes you uncomfortable. Those are often dissonant sounds.
So
So like
lack of harmony.
yeah, a lack of harmony. Like if somebody's playing like the wrong notes and you almost recognize the tune, but you can't because they're jacking it up, or the piano's out of tune, something like that. And you're just like, oh, and it's just like that amount of uncomfortableness.
That makes so much sense.
Yeah. So thank you for that. And so that's what I want you all to think about, like how would you visually represent, or, in auditory terms or in physical tactile terms, right? Represent these feelings that you have when you have these experiences. And then you share these feelings with others if you feel so inclined. Obviously, everybody's taking their own path, but this is what I do. I have a piece that I did. It was a painting of, actually, I'll pull it up for you, of Rigoberta Menchú. And she was, and actually still is, also still alive. She is a Nobel Peace Prize winner. And she won the prize for helping to show the experiences, the levels of atrocity that was experienced by the Mayan peoples of Guatemala. Guatemala underwent a civil war that started in 1960 and lasted until 1996. And she wrote this book called My Name is Rigoberta, and This is How My Conscience Was Born. And she speaks about the family members that she lost due to government action and government inaction. And so in this piece that I'm showing on screen, and I'll describe it for you, Mary, I've got a picture of Rigoberta. I have her portrait to the left. And then and the whole piece is shaped almost like a cross, but it's dissonant in its way. They don't line up, right? It's not a symmetrical, perfectly even cross. One side is higher than the other. The right side of the cross is up. And on the right side, right, kind of starting in the bottom of the X and then moving up and to the right, you have pictures of crowds of people. There's a woman holding a sign that has a picture of her son's face. These are the desaparecidos, the people who were disappeared and never returned. You have pictures of skull and crossbones. You have mass graves. There's actual bullet shell casings. So I had 2 shell casings that I cut in half. And so now there's like 4 bullets going across this. It is dark in color. It is very textured. It's like a deep purplish, reddish, like it feels like bloody and murky. As we go up, so if we start at the center and go straight up, so from the top of the cross and then coming down to the left towards Rigoberta Menchú's face, we have the Mayan pyramid. We have families in like all of the colorful, traditional garb. There's 2 women, one just above the pyramid and one further up and to the right. And they're holding their fingers up. So they have got one index finger up and the finger has a red mark on it, because that's how people vote in Guatemala. They make a mark on a ballot indicating the candidate that they want to vote for. And she actually had run for public office. She didn't win, but she ran and her people voted for her. And then you have people thriving. So in this image, right, I have the vision of the past and the atrocities that were taking place in this dark area. And like I said, it's very textured. The texture is very rough. So it looks and feels like physically rough to the touch. And then, and it's dark and it's, it just looks like horrible things were taking place. And then on this other side of the picture is hope. It's hope for a past that is being honored. It is hope for a future that is being reclaimed. And, people are actually working toward their own good. And they're finally in the situation where the government is not actively killing them off. And so they can actually do their work. So I wanted to just give you how something like this thumbnail that we've been working on can manifest into a more full-on visual. So we have 5 minutes left. If anybody has anything else that they would like to add or any questions they would like to ask of me, now is a beautiful time.
Audrey, one question I had, and I was thinking about, this is Adela from CCHI. One of the things we hear so much about, and I think so many of us have experienced, is that deep sense of anxiety or fear. Sometimes we call it toxicity, around either not being able to afford to access care or having received these giant bills that you just, there's a fear that it's going to completely disrupt your financial stability. You may not be able to pay your rent or get groceries. So, and you can feel that right down in your belly, you know, that fear. I've been there before, finding out that I was pregnant 16 years ago. I had no insurance, and what was I going to do? And that it's really visceral. So I wonder how would you represent that visually, that really visceral feel of fear and toxicity?
So you may not like my answer. Every one of us has access to this, and every one of us manifests this in our own way. So really the thing to do is make art. Get some materials and play with them. And don't play with them in the traditional way. Get your hands dirty, you know? I have a piece that I did of Malala Yousafzai, and I was in a mood. I was with my now ex-wife. We were living with her parents. They had pissed me off in some way. I was in the middle of working on this piece for a show, and I was doing the background of the piece, and I just found myself just almost unconsciously mixing a red paint and then putting my hand in the mixture and just putting it on the canvas and smearing it. I didn't know I was going to do that. I didn't plan to do that. It was a very visceral reaction for me to put that into the piece. I'm lucky that it fit. It made sense to the story that I was trying to tell. But that's the thing I want you to do, you know, rather than me telling you, this is how you achieve this feeling. I want you to have the feeling and have some materials and see what happens and just do stuff until you see that feeling on the paper. So that's my answer to you, because I don't have that visceral response. I've never been pregnant. I have VA medical coverage, which means that, you know, barring some massive policy shift, I'm actually okay in that sense. So I don't know what that is, and I can't describe it to you in order for you to be able to describe it to somebody else. So that's something that only you have access to. So, you know, experiment, see what happens.
And what I'll add is this is a very important reason why all of our stories are valuable in healthcare policy and engagement. Not all of us have the same experiences. So the more voices we have there and the more we repeat these stories, the more we can show others that they're not alone in what they're going through. And the more those stories don't get lost, right? We all have ability to tell our story and advocate for ourselves. But as we've seen through these exercises, sometimes people just don't listen to us. But it's really hard to listen to 15 people that are outside of the Capitol or inside when we get back. Thank you. This has been beautiful.
Yeah, so I want to thank you all for, you know, I want to thank you, Miriam, for inviting me. Thank you all for participating and for being open to telling your stories and sharing your perspective. It's definitely perspective that I didn't have for myself. And so I have learned from you, and hopefully you have also learned from me.
Thanks so much, Adri. So we are going to move into a break here. We will throw up a few links on the screen for some ways that you can participate, and we'll drop those in the chat box as well. We're going to reconvene at our agenda said 10:20. I'm going to actually bump that to 10:25 and give us a few more minutes, grab some coffee, take a little breather, have second breakfast, whatever is most appropriate for you. And we'll reconvene at 10:25 to move into our regional breakouts, in which we should have some legislators who are joining us to just talk a little bit about sort of how your priorities may align with some of the work that they're doing at the Capitol, and it give you a chance to ask them some questions. So we will see you all back here at 10:25. Thanks, everybody.
Thank you. Bye.